Alright, let's dive into something that's both fascinating and, honestly, a bit eye-opening. Imagine if I told you that 3 simple, yet often overlooked, health factors in midlife could potentially delay dementia by 13 years. Yeah, you heard that right. A recent study published in Neurology has been making waves, and it's got me thinking about how small choices today could shape our brains decades from now. But here's the kicker. It's not just about avoiding dementia. It's about adding quality years to your life. So, let's break this down. First off, the study zeroed in on 3 midlife health markers: normal blood pressure, no type 2 diabetes, and not smoking. Now, personally, I think what makes this really interesting is how these aren't exactly groundbreaking revelations. We've known for ages that smoking is bad, diabetes is a health risk, and high blood pressure isn't great. But what's striking here is the magnitude of the impact. We're talking about nearly 13 extra years of dementia-free life. That's not just a number. It's potentially an entire chapter of your life reclaimed. What many people don't realize is that these factors aren't just about heart health. They're deeply tied to brain health too. If you take a step back and think about it, this raises a deeper question. How much of our future cognitive health is in our hands right now? Now, let's talk about the study itself. Researchers from NYU Langone Health analyzed data from over 12,000 people, tracking them for about 3 decades. Here's where it gets wild. Those with none of these risk factors lived almost 13 years longer without dementia compared to those with all 3. Even having just one of these risk factors shaved off years of dementia-free life. For instance, someone with all 3 risk factors had just over 17 years of dementia-free life, while someone with none had over 30 years. That's a massive difference. One thing that immediately stands out is how incremental changes, like managing blood pressure or quitting smoking, could have such a profound long-term effect. It's almost like these factors are compounding interest for your brain. But here's a detail I find fascinating. The study also highlighted disparities. Women, on average, lived longer without dementia than men, and white participants had more dementia-free years than black participants. This isn't just a footnote. It's a reminder that health outcomes are shaped by systemic factors, not just individual choices. From my perspective, this underscores the need for equitable access to healthcare and preventive measures. If we're serious about delaying dementia, we can't ignore these disparities. Now, let's zoom out for a second. The global forecast for dementia is staggering, 153 million cases by 2050. But here's the hopeful part. Experts believe nearly half of these cases could be prevented or delayed. Previous research has identified 14 modifiable risk factors, but this study hones in on 3 that emerge in midlife. Why does this matter? Because midlife is often when people start to feel invincible. Careers are thriving, families are growing, and health seems like a distant concern. But this study is a wake-up call. What this really suggests is that midlife isn't just about building a career or saving for retirement. It's about laying the groundwork for your brain's future. Dr. Jackie Hanley from Alzheimer's Research UK put it perfectly. This study shifts the focus from if you'll develop dementia to how long you can live without it. That's a game changer. It's not just about avoiding a diagnosis. It's about maximizing the years you have with clarity, independence, and quality of life. Personally, I think this reframes the conversation around dementia prevention. It's not just about fear. It's about empowerment. Small, manageable changes today could mean a decade or more of cognitive health tomorrow. So, where does this leave us? In my opinion, the takeaway isn't just about blood pressure, diabetes, or smoking, though those are critical. It's about the bigger picture. If we can tackle these 3 factors, we're not just delaying dementia. We're potentially transforming how we age. But here's the thing, it's not just up to individuals. Society needs to step up too. Access to healthcare, education, and resources to manage these risk factors needs to be universal. Otherwise, we're only solving part of the problem. As I wrap this up, I'm left with a thought-provoking question. If we know these factors can add 13 years of dementia-free life, why aren't we talking about them more? Why isn't this front-page news? Maybe it's because it's not as flashy as a new drug or breakthrough treatment. But honestly, this feels like one of the most actionable pieces of health advice I've come across in a long time. So here's my challenge to you. Take this seriously. Whether it's getting your blood pressure checked, managing your sugar intake, or quitting smoking, these small steps could add up to something extraordinary. Because when it comes to your brain, every year counts. What do you think? Are we underestimating the power of these midlife choices? Let me know in the comments. I'd love to hear your thoughts.